I was fortunate to be able to see Prime Minister Imran Khan today, Monday the 4th of November 2024, in Adiala Jail in Rawalpindi. It is almost exactly 10 weeks since I was last given permission to see him. When I met Khan Sahib this morning, he appeared to be in his usual high spirits. His only complaints were of ringing in the ears, which medically is known as tinnitus, which he has had for several months now, and for which he is on treatment, as well as some ongoing numbness in a small part of his left foot. This is a residual of the injury he sustained when there was an attempt on his life in November 2022 and he received bullet injuries to his left leg. On examination today, he looked very well. He was freshly shaven and had good skin color. His heart rate was 50 beats per minute. His blood pressure was 110/70, and his oxygen saturation on room air was 98%. As I have said before, his vital signs reflect very good general health and are in keeping with his rigorous exercise regime over the course of his life. I listened to his chest and his heart sounds, and they were also normal. I did feel today that his muscle tone was somewhat reduced as compared to earlier examinations. This is likely to be because of recent curtailment of opportunities for exercise, which have now thankfully been restored. I'm confident that this will improve rapidly if he is allowed to continue to exercise in the manner to which he is accustomed, and there should be no long-term consequences as a result of this. I was accompanied today by a team of doctors from the Pakistan Institute of Medical Sciences, or PIMS, in Islamabad. This team included an ENT, or ear, nose and throat consultant, who advised medication to help with the ringing in Khan Sahib's ears. I concurred with his opinion, and we have made a recommendation for a change in medication accordingly. I have also suggested that he take a tablet of calcium and vitamin D once daily in order to make up for any deficiencies associated with lack of adequate exposure to sunlight and fresh air. Some blood samples were taken and sent to PIMS for analysis. The results of these are now available and have shown no abnormalities apart from a slight elevation in his cholesterol. Khan Sahib is known to have a high cholesterol level and is already on medication for this. I will be making some recommendations shortly to try and improve his cholesterol level further. It is very important that Khan Sahib's own doctors from Shaukat Khanum, myself and Dr. Faisal Sultan, be given regular access to see him so that we can keep abreast of his medical condition. I'm sure that we both look forward to seeing Khan Sahib at regular intervals in the future. Thank you.